This is a VEINWAVE training video. My name's Dr. Brian Newman. I'm the consultant surgeon who's developed this technique over the last 10 years throughout the United Kingdom and Europe. The treatment's going to show various methods of dealing with telangiectasia, both on the face and the legs. The first part is handling the needle holder, and it's very important that the tip of the needle is bent to 45 degrees, so the needle is always at 90 degrees to the skin surface. This video of nose veins shows the small veins being treated first of all on the side of this patient's nose. As you can see, we're going just subepidermal with the needle and starting with the very fine veins rather than the big veins. Some of these, of course, can only be seen under the polarized light which is being used here to visualize these veins. It's very important that you are entirely accurate running along the line of the vein. Now, when we come to a larger vein, you can see we start at the periphery and run along the length of the vein, slowly clearing it. Each incision is approximately 1 or 2 millimeters apart. It varies somewhat in different areas of the skin, depending on how much fat there is and how far the heat will travel out. This little angiomatous area, we start at the side, run round it, and then just hit it in the middle and it'll disappear. Now this large vein, again we start at the periphery, run along the vein and get to the larger part of the main surface of the vein. By starting at the periphery, we decrease the flow. At all times the needle must be absolutely clean. If the needle is not clean, you run the risk of causing some skin discoloration. You'll notice that as we're running along the vein, there's no smoke and very little in the way of bleeding. When you come to a large vein, it's important to start on either side of the vein, narrowing it down, and once it's narrowed, we then go through the center of the vein. This decreases any bleeding that you could get. Sometimes with a large vein you may need to go over it 4 to 6 weeks later. Most of these will be cleared, and you can see here immediately afterwards that the nose is completely clear under polarized light. A little bit of subepidermal edema and that will settle within an hour. And this is the before and after picture. Now, VEINWAVE is also very useful for the treatment of nose veins and intranasal veins, and has probably become now the treatment of first choice for the treatment of nasal, perinasal and intranasal veins. On this patient, we're starting again with the veins on the top of the nose. It's always a good idea to deal with this first of all. I should make a point that we do not prep the skin prior to treatment. The temperature setting is 40 and 0.2 power on the machine, which is heating the tissue sufficiently to kill any superficial bacteria. In its use over the last 10 years, I have never seen an infection. It's important also, if possible, not to use any topical anesthesia, as this causes vasoconstriction. None of these veins that you're seeing treated on this video have been given any analgesia or anesthesia, and you can see as we go around the side of the nose, which is an area that is in fact a little tender, we generally don't have any serious discomfort. Intranasal veins occasionally cause a bit of reflex eye watering, and occasionally a patient may require a little bit of preoperative brufen. You can see also, as the video proceeds, the needle remains completely clear. It's always held at 90 degrees to the skin surface, and the incision is just subepidermal. It's very important that there's no depth in incision, and there should be no tenting of the skin. If the needle needs to be cleaned, just clean it with a small piece of cotton wool. And here you can see the very tender intranasal veins being cleared. In my opinion, over the last 10 years, this has proved the best treatment for clearing this type of telangiectatic vessel. This shows the immediate after picture. There's no particular aftercare. The slight subepidermal edema and redness settles down, usually within an hour. The treatment is also very useful for small angiomas on the lip, and this shows one just being treated, and usually just one touch with the probe will clear the lesion. This is another example of the alar veins being cleared, and you can notice in this some degree of redness along the side of the nose, and these veins are always part of an inflammatory process, which generally we settle down using a mild topical acid preoperatively. It's very important because this prevents the veins from recurring if you can get rid of the inflammatory process. These veins are very fine, and as you can see, it's very important not to get any tenting of the skin and to only have a small amount of treatment pallor. If you go too deep with the probe, then postoperatively you'll obtain quite a considerable amount of microcrusting. Fortunately, there is no risk of any scarring. These are the little lip angiomas, and just one touch will clear it. This again shows some large veins around the side of the nose and a particularly large intranasal vein. Now, when we set the machine for treatment of nasal, perinasal and leg veins, the setting that's used is 40 and 0.2 on the machine. The needle size is always a K3.